Because one of the three things, the three most common things that commonly masquerade as fibromyalgia and get someone an incorrect diagnosis, one of them is true muscle, musculoskeletal problems like myofascial pain syndrome, trigger points, things like that. Or multiple facet syndromes, disc lesions. There's a lot of other musculoskeletal things that can be, but those trigger points are the biggest.
Okay.
Number two, not necessarily in ranked
Yep.
order, would be energy deficiency from mitochondrial biochemistry issues.
Yep.
The person has some problem in producing enough ATP. If you're not producing enough ATP through aerobic mitochondrial respiration, you're going to be tired, your brain's not going to work very well, so you're going to have cognitive dysfunction or so-called fibrofog, and you're going to back up in the energy biochemistry into anaerobic pathways where you then try to get a little bit more energy out of pyruvate when it comes down from glucose, and you make lactate.
Right.
And now it's laying in all the muscles. If you go push on their muscles, that acidic metabolite hits those nociceptors and voila, they hurt everywhere.
Sure.
But it's really not a central pain processing disorder. In that patient, they have toxic metabolites out in all the muscles. So you need to fix the metabolism. So that's number two, mitochondrial sort of uncoupling. And then number three would be an underappreciated or undiagnosed hypothyroidism that's not overt enough to where the TSH goes up through the roof and the T4s are very low, but it's more of a conversion T4 to T3 or a T3 resistance syndrome or a high reverse T3 production, but it's something where you got to manage it much more tightly and look for it, or else if you just use the conventional way of looking for thyroid disorders, you'll miss a lot of it.